Hello guys, welcome back to the channel. It's Unit 8 Part B. Malpresentation. By knowing malpresentation, I will also join with malpositions also. Like that you'll understand way better. In malpresentation, first of all, what is malpresentation? See which part of the baby is visible in the lower pole of the uterus. In this region, in the delivery region, which part of the baby is shown, that is presentation. For example, in this, if you see in this way, the baby's face is visible. So that is face presentation. In this, more like baby's forehead and brow is visible, that is brow presentation. In this, the baby's shoulder and hand is visible, that is shoulder presentation. And in this, if you see compound is nothing but extremities, either leg or hand. Sometimes even hand is also considered compound presentation. And cord is nothing but umbilicus cord. If the cord is interrupting, then that is a cord presentation. Apart from this, we have still two, that is vertex and breech. Vertex is nothing but head. This face and brow can be considered as vertex, because head presentation is the first presentation. But whereas you see breech is exactly opposite to it. Breech is the leg lower extremities, this presentation. This will be visible first. Malpresentation is during the delivery, what is visible. Like if head is visible, that is head presentation. If leg is visible, that is compound presentation. Like that. Malposition is nothing but if baby is facing right side or baby is facing left side, baby is anterior, baby is posterior, baby is lateral or not, in which position the baby is facing, that is malposition. Vertex representation. Here you can see the head, and occipital is the position which is visible. The head can be visible, okay? So if the baby is facing this side, that's right. If the baby is facing this side, it's left. And if the baby is facing up, it's posterior. If the baby is facing down, it's anterior. If the baby is facing sideways, that is lateral. These are the things you need to keep in your mind. Here the first position is right occipito anterior. The baby is facing right side. The head is visible, that is occipito, and it's facing downwards. Downwards, right side. Right occipito anterior. Straight, it's facing straight. Straight occipito anterior. Left occipito anterior. Left occipito posterior, it's facing upwards. See, left side. Left occipito posterior. Right occipito posterior. The baby is facing right side and it's facing upwards. It's right occipito posterior. Straight occipito posterior. And here right occipito transverse, left occipito transverse. These are the positions that are seen in the vertex presentation. Face presentation, if you see in this condition, the baby's face will be visible during the delivery section. And if the baby is facing this side, it's left side. If the baby is facing this side, then it's right side. If the baby's head is towards downside, it's anterior. If the baby's face is towards upside, that's posterior. If it's towards sideway, then that is lateral. Let's see the malpositions in the face presentation. Right mento posterior. Right side head, that is face is visible mento, and the head is almost facing towards upwards, posterior. Right mento posterior. The same way if you see here, the baby is left side, mento is visible, and the head is facing towards upwards, posterior position. Left mento posterior. Right mento lateral. Right side, the baby is facing right side, and mento is visible, and baby is placed lateral. Left mento lateral position. Right mento backwards, it's facing backwards, see, anterior position. Right mento anterior position. Left mento anterior position. These are the malpositions that is present in the face presentation. Breech presentation. If the baby is facing this side, it's left. If the baby is facing this side, it's right. If the baby's head is facing backwards, see, this baby's head is facing backwards, it's anterior. If the baby's face is facing towards front, it's posterior. Or else if the baby is facing lateral, either this position or this position, it's lateral. Okay, first, left sacral anterior position. The baby is facing left side and it's facing backwards. This is left sacral anterior position. Sacral is nothing but the butt part. In this breech presentation, the butt part will be visible at the time of delivery. So this is sacral. Here if you see, left sacral posterior position. The baby is facing left side and it is facing forward. That is left sacral posterior position. Here, left sacral lateral position. The baby is facing lateral wise in left side. That is left sacral lateral position. Here, right sacral anterior position. The baby is facing backwards and it is facing right side. That is right sacral anterior position. Here, right sacral posterior position. And here, right sacral lateral position. These are the malpositions that is present in the breech presentation. During breech delivery, we do see only few things like types of breech delivery. Apart from seeing the positions, that is either the baby is in the complete breech position or frank breech position or footling breech position. See, complete breech position is the baby's legs will be completely folded, there is no extension. But in the frank breech position, the baby's both leg will be extended. In these two conditions, the baby legs, both legs will be in the same condition. Whereas the footling breech position, if you see, one leg will be folded and one leg will be in the extended position. The chances is, if you see, this frankling position is 65%, the complete breech position is 25%, whereas the footling is just 10%. This is how the cases are occurred in the breech presentation. Cause of breech presentation, in this we see the first is the fetus. If the delivery is occurring in the preterm, at that time this breech presentation is seen. Generally more preterms are breech presentation. Apart from this, if there is multiple pregnancy or if the fetus has any abnormalities or any infection, congenital infections can lead to breech presentation. And next, liquor. Liquor is nothing but amniotic fluid, either polyhydramnios or oligohydramnios. Any condition can lead to breech presentation. And then uterine. If there is any defect in the uterus or any kind of tumor is found in the uterus, then that can lead to breech presentation. Placenta previa is the best example that leads to breech presentation. And then pelvic. If there is any destructive, that is the structure is not in the proper way in the pelvic, or any kind of injuries can lead to breech presentations. These are the causes that leads to breech presentation. Management of breech presentation. Generally, breech presentation is seen in the preterm babies. Those are like 7.5 months delivery sections. We generally go with C-sections. Apart from this, if there is any kind of underlying disease conditions or any kind of malpresentations, then we will get breech presentations. Like disease conditions like polyhydramnios, oligohydramnios, preeclamptic, placenta previa, these conditions leads to breech presentation. So apart from this, generally in breech presentation, we will try to do breech delivery, the normal delivery. If that's not possible, then we will go to C-section. So before conducting the delivery section, we will arrange everything that are required for C-section. Management of breech presentation, the notes will be provided after the explanations. So for the example, let's take the right sacral anterior position. This is the breech presentation. In this presentation, the baby engages in the right sacrum anterior position. In further, due to the flexion and the movement, the baby turns a bit and it comes to the anterior posterior diameter position. And this diameter is also known as barocentric diameter. In further moving on, the butt will be clearly visible And in this position, the doctor tries to take the baby out. If the outlet was not enough, we will even perform episiotomy at this condition, the occurred here. And the baby butt is born by an groin traction action. The baby's butt will be removed out, and do ignore that baby's legs are out here, but actually still the baby's legs are inside the womb. The main purpose of this image is the baby's hand are in the transversal position, that is in this position. This length the baby's hand are present. That's why this image is presented in this way. See, when the baby's butt is born, the baby rotates 1/8 this way. The baby has been rotated. At this rotation, the baby's hand comes to an transversal diameter. And after this, by moving in a lateral way, the baby's legs, lower extremities, will be removed one after the other. And at this condition, we will be interrupted with the umbilicus. On delivery progresses, the umbilicus is removed carefully. With that, the upper extremity, the shoulder, will be removed carefully due to the flexion. And at the final time, the baby's leg will be holded and the birth of the baby will be performed in the upside down position. And this is how breech delivery is performed. Any disturbance or obstacles found during the delivery, then we do use forceps to perform this delivery. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.